Why do you say the more subspecialized you get, the closer you get to being a primary care doctor?
So it's a unique situation in multiple sclerosis because of the more in multiple sclerosis, it's a chronic disease that is treatable, and so we're seeing patients over years and decades. And when I went to medical school, being a primary care doctor was actually what I thought what I was going to do before I became a neurologist, and I just fell in love with neurology. But a lot of what I liked about primary care, you get in MS specialty care. I'm seeing people who are diagnosed young, and I'm talking to them about family planning and things like that in the setting of disease modifying therapies. And I'm seeing people who are older and going through retirement and talking about, okay, financial changes and going on to Medicare. What does that mean for your treatment? Or just age and the reduction in MS activity and discontinuation. How long do you have to be on treatment? How strong of treatment do you have to be on? Your risk of infections go up. And so I really do get that lifespan of care. So that's one thing that's just inherent in MS. But then specifically, kind of the more I get subspecialized into my niche of research, being kind of these health disparities potentially caused by comorbidities and the treatment of hypertension, that then has this huge crossover with primary care doctors and screening. And one of my big points that I made in my presentation yesterday is that we're looking at hypertension awareness. A lot of MS patients, just anecdotally, they just see their MS doctor, and they don't necessarily get as cued into their primary care doctors that they have. And I don't know if this contributes to the findings that I have or not. We'll have to do more research to really look into that. But what we found was basically we looked at hypertension awareness, and hypertension awareness is someone who has high blood pressure. Are they aware that they have high blood pressure? Do they report they have high blood pressure? Do they take their medications for high blood pressure? Or do they not even know that they have high blood pressure? And basically what we found is that in a population of multiple sclerosis patients here in Phoenix, that over 50% of people who could be diagnosed with high blood pressure by vital signs had no evidence in the chart that they were diagnosed with high blood pressure. They weren't taking any high blood pressure medications. They appeared to be unaware that they met
Mm.
diagnostic criteria for high blood pressure. And interestingly enough, the people, when we looked at risk factors for hypertension unawareness, meaning that they didn't know they had high blood pressure, the risk factors for that, the associations for that, I should say, were women, young people, and people with less severe hypertension. So, less severe hypertension kind of makes sense. If you have a really big high blood pressure number that's going to catch everybody's eye, you're going to find out more. Whereas if it's borderline, some people might say, oh, maybe it's just a little stress of being in the doctor's office or things like that, but then they're consistently there. But there's a big gap in care there for the other two, right? There's no reason not to be diagnosing and catching women with high blood pressure in MS, and young people, specifically, who maybe aren't going through all the screenings that they need to. My hypothesis, not proven in our work, are being missed, and so it might be an area where MS specialists, even though we're not primary care doctors, could play a significant role in improving the diagnosis of high blood pressure in patients with MS. And maybe we don't actually treat that or things, but we make sure that patients are aware and get them into primary care doctors, talk to them about the importance of their overall health, right? And I think that's becoming a big thing in MS too, is like, it's not just, yes, first step, you see me, we need to get you on a disease modifying therapy that's going to prevent disability, going to prevent inflammation. But then it's about all of your wellness and brain health and keeping as healthy as possible for 20, 30 years with this disease that are going to make a lifetime of difference. And so the more and more we get into subspecialty information about MS, the more and more we're like, it really is about all of these wellness things that primary care doctors have been looking at and talking about for decades.
Yeah, interesting.